Okay, so we're going to talk about AAAs. Now, AAAs, or abdominal aortic aneurysms, are going to occur typically here in the descending aorta, or less commonly here in the common iliac artery before it becomes the femoral artery, and that can happen on both sides. The most common place, like I said, is here. And so a lot of instructors in paramedic school say, hey, we should be taking blood pressures on both sides. And they're correct, but they need to be a little bit more detailed in that response, because what we need to be doing is making sure that we're checking it on bilateral thigh pressures, not just the upper extremities, because in a descending aortic aneurysm or a AAA, there's not going to be any difference between the arms, okay, but between both arms. But there may be a difference between both legs. But there's a big caveat to that. It's all about location. If the aneurysm is in the most common location, which is the descending aorta, there's not going to be a difference between the legs because both legs are going to be affected the same. However, if the aneurysm is in a less common area, which is the common iliac arteries, then the leg that has the aneurysm is going to have a lower pressure than the comparison to the other one that has no aneurysm in the bifurcation of the common iliac artery. And so that's why we need to be checking blood pressures on both sides with descending aortas, but not on the upper extremities, but on the lower extremities. Another little caveat, or another tip to bring into this as well, if you have an aneurysm in the descending aortic aneurysm or descending aorta here, and you do thigh pressures, and you notice your pressures are lower than you would expect for a normal intensive patient, then you do upper extremity pressures, and you notice that the pressure is much higher in the upper extremities and then lower in the lower extremities. That's a positive indication of possibly a aneurysm here in the descending aorta, because that's suggesting that we're having lower perfusion or lower blood flow into the lower extremities and regular to normal blood flow in the upper extremities. Just another little thing about blood pressures. But when we're talking about AAAs, it's important to understand that when we're saying checking blood pressures, we're checking thigh pressures, not just upper extremities, in order to indicate if there's any differences in blood pressure.
All you need to do is hit the link in the bio, and we're going to send all of our daily videos straight to your email so you can get your daily dose of medicine.